And then for these people who are liver transplant candidates, you had mentioned to me that it was important that they have a good social support system and a health insurance system and some other issues. Tell us.
Right. So a lot of the criteria for qualifying for transplant are based on the fact that it's very important that we have a high success rate in transplantation because there's so few organs available. As we said, in kidney transplantation, there are about 85,000 people on the list. There are only about 16,000 kidney transplants every year. And for liver, I think there are around 16,000 patients on the list, and there's only about 6,000 liver transplants every year because the limitation of donors. So it's very important that we have a high rate of success in these transplantations, and there's been quite a few studies that show that you need a strong social support because without a strong social support, there's a higher rate of failure of the transplanted organs, both kidney and liver.
So you mean social support, you mean ability to take the medicines, compliance with the medicines, have a stable, supportive family that will nurture you while you're recovering?
Right. So if a family's nurturing you, there's frequent doctor's visits. So at Stanford, we see patients after kidney transplant twice a week for the first month, once a week for the month after that, and once every other week for the month after that. So there's frequent doctor's visits. There are a lot of medications that you absolutely need to take after transplant, and it's always helpful to have a spouse, a daughter, a parent who's involved in helping you keep up with the medication regimen.
And so after a while, how long do they resume a lifestyle that's conducive to going back to work? Is it about 6 months or what?
So there's quite a bit of variation, and it depends a little bit on how sick the patient was beforehand and how old the patient is. Commonly for kidney transplant, patients are able to go back to work after 2 months. For liver transplant, it may be 2 months, it may be 6 months, maybe a little bit longer for liver transplant.
So you also need an understanding employer, and it takes almost a community. That's why in some new community newspapers they have donation drives and fundraising to help these liver cancer transplant patients.
So obviously both these therapies are very expensive. It's pretty clear cut that kidney transplantation over 5 years is more cost effective than dialysis. Liver transplantation is even more expensive, and often patients do have fundraising drives to help pay for it because the cost itself can be prohibitive for some people.
And I know that communities have to be supportive of these people because sometimes they're going to be out of work for a long time, and this person could be a valued member of a corporation, of a community.
Right.
And how do you tell all these people? What do you say to them that, if you have a very bad MELD score, and what do you say?
Right. So, in the liver transplantation time, people with a very high MELD score are often out of work already. So they getting a transplant, they go back into the workforce and they try to get a job, and it's often very difficult. Kidney transplant people are often able to work up to the time of transplant, although as you mentioned earlier, the dialysis schedule is very disruptive to them. But I would think most employers would be very supportive of this because once their employee gets a kidney transplant, they should be able to work on a more normal schedule, actually.
Now, we've had a lot of media press. Steve Jobs got a liver transplant, and that really made all of America aware that, what it involves. So tell us a little bit about what that meant for all of you transplant surgeons.
Well, the one thing, Steve Jobs has brought some attention to this, and he's actually made some statements publicly about the importance of organ donation and how he was very fortunate enough to benefit from a family that donated someone's organ to him. And anytime there's someone prominent who gets a transplant, this does bring a little bit of light to the problem, and he's actually was at a press conference approximately 2 weeks ago with Dr. Schwarzenegger pushing through, promoting a new bill in the California Assembly to increase the number of potential donors here in California.
Now, Right now, there is a computerized list that's nationwide, and every transplant center has this list. And I'm sure that there are certain states the wait lists are shorter or longer. Why is that?
So it has to do with how many, it's a supply and demand. So it's how many patients are in your area and the prevalence of disease in that region versus the number of donors. And it's a complicated why some regions have higher donation rates and why other regions have lower donation rates. And it's also complicated of why some regions have a higher rate of liver failure versus other areas. In the Bay Area, there's a high proportion of Asians, and a large portion of Asians have hepatitis B from transmission from birth. And so there may be a higher rate of cirrhosis in the Bay Area, which explains why we have a longer wait list.
Now, there are probably other areas where there's more chronic alcoholism, like let's say in Russia where there's more alcoholism. Russia compared to the United States, what are the transplantation rates? Are we the #1 transplantation center in the world, in America?
I actually don't know the numbers in that.
Or are we more active in transplantation surgery than other parts of the world?
So we are very active. I mean, just because of the high-level medical centers in the United States. But for example, in Korea is very active in doing living donation for liver transplantation. The culture in Asia discourages deceased donor donation frequently in Japan
because of
and
Buddhism.
Korea. I believe so, yeah. So there's a higher percentage of living donations. So there's some centers in Korea that do 100 living donations in a year. Whereas in the United States, there are only about 200 living donations for liver every year.
Oh, so ours are much more cadaver.
In the liver transplantation, in kidney transplantation, the United States has about 6,000 living donors every year. There are also about 6,000 deceased donors, but each deceased donor has 2 kidneys, so there are actually over 10,000 deceased kidneys donated every year.
Oh, because there are 2 kidneys per person, so you can meet the need better.
Right, right.
Now, the growth of transplantation rate must be, increasing as more abilities to harvest donors, organs and stuff.
So that was true for the 1990s and up to about 2006. Actually, the numbers have plateaued in the last 3 or 4 years.
Because the demand has grown?
No, the actual supply has plateaued.
Oh.
So the number of deceased donors has plateaued off, and even the number of living donors have plateaued off. So as I said, about 10,000 for kidney transplant, about 10,000 deceased donor kidneys are transplanted every year, and about 6,000 living donor kidneys. There's been a big push in this country to increase the number of living donors. There are a few studies saying that people who donate a kidney do just as well in long-term life as people who don't donate a kidney. That's not to say that donating a kidney doesn't have some risks, but the benefit of a living donor are actually multifold. One including the organs tend to live longer, survive longer if they're donated from a living donor, and they tend to work faster. So, and you can time the transplants better. So you can get a living donor kidney transplant earlier on in your disease course than you can get a deceased donor, because the deceased donors are on the deceased donor waiting list, which is, like I said, 8 years for an O blood type.
Wow. So there's also probably new research done on how to, for liver transplant patients, how to live longer while they're waiting for a transplant. Is there some sort of artificial liver being developed?
Right. There are several companies looking at artificial livers. There has not been shown to be much success with those yet. Those companies may beg to differ with me on that, but it's not a commonplace. It's not like dialysis yet. I think where more of the research being done now is in hepatitis B and hepatitis C. There are some new medications coming out to the market for hepatitis C, and hepatitis C is probably the most common cause of liver cirrhosis leading to transplantation at this time.